The Hippocratic Corpus, a collection of around 60 medical treatises, stands as a cornerstone in the history of medicine, attributed, perhaps inaccurately, to Hippocrates of Kos and his followers. This body of work represents a significant shift away from supernatural explanations of disease towards a more rational, observational approach. Its influence on medical ethics, diagnosis and prognosis continues to reverberate through modern medical practice, although the precise authorship and dating of the individual texts remains a subject of scholarly debate. The genesis of the Hippocratic Corpus is intertwined with the broader intellectual ferment of 5th and 4th century BCE Greece. Prior to this period, illness was largely attributed to divine intervention or demonic possession. Healing rituals often involved sacrifices and incantations, overseen by priests or shamans, figures such as Alcmaeon of Croton, who advocated for a naturalistic understanding of the body, and the philosophical inquiries of the pre-Socratic thinkers laid the groundwork for a more empirical approach. The rise of Ionian natural philosophy, with its emphasis on observation and rational explanation, provided a fertile ground for the development of a secular medicine. The medical schools of Kos and Cnidus, the latter possibly advocating for a more symptom-based diagnostic approach, competed to produce a more effective means of managing sickness. The corpus itself exhibits considerable variation in style, content, and philosophical outlook, suggesting it represents the accumulated writings of several authors and generations of physicians. Some treatises, such as on airs, waters, places, explore the influence of environmental factors on health, meticulously describing the relationship between climate, geography, and the prevalence of certain diseases. This work emphasizes the importance of considering the patient's environment when making a diagnosis, a principle that remains relevant in public health today. For instance, the treatise notes the correlation between stagnant water sources and the occurrence of specific ailments, showcasing a rudimentary understanding of epidemiology, although the germ theory of disease remains centuries away. The authors of On Airs, Waters, Places note the effects of varied types of water on the body, noting the effects of hard water on the development of bladder stones. Other texts focus on specific areas of medicine, such as surgery on fractures, on dislocations or gynecology diseases of women. These treatises offer detailed descriptions of surgical procedures, including the reduction of fractures and the treatment of wounds. The gynecological texts demonstrate a remarkable understanding of female anatomy and physiology, describing conditions such as uterine polyps and infertility. On the Sacred Disease directly challenges the prevailing belief that epilepsy was caused by divine intervention, arguing instead that it was a natural disease originating in the brain. This treatise represents a bold assertion of rationalism in the face of superstition, advocating for a purely medical explanation based on the observation of symptoms. A particularly significant contribution of the Hippocratic Corpus is its emphasis on prognosis, that is, the prediction of the likely course of a disease. Several treatises, including prognostics and aphorisms, offer detailed guidelines for assessing a patient's condition and predicting the outcome. These texts emphasize the importance of careful observation of symptoms, including pulse, respiration, and skin color. The authors recognized that certain signs indicated a favorable prognosis, while others suggested a more grave outcome. For example, aphorisms famously states, "Life is short, the art long, opportunity fleeting, experiment perilous, judgment difficult." This sentiment highlights the challenges faced by physicians in antiquity who lacked the sophisticated diagnostic tools and treatments available. The Hippocratic Oath, perhaps the most well-known text associated with the corpus, outlines a code of ethical conduct for physicians. While its authenticity as a genuine Hippocratic work has been questioned, the oath embodies the ethical principles that are central to the Hippocratic tradition. It emphasizes the physician's duty to act in the best interests of the patient, to avoid harm, and to maintain confidentiality. The declaration against providing deadly drugs, performing abortions, or engaging in sexual relations with patients reflect the high moral standards expected of physicians. While some of the oath's specific prohibitions may no longer be universally applicable, its underlying principles continue to inform medical ethics today. It is worth noting that variations exist in the exact wording of the oath, reflecting the evolving ethical considerations within the medical profession. A phrase contained within the oath states that the physician will maintain absolute discretion, regardless of what they may see or hear while treating the patient during the course of their duties. The influence of the Hippocratic Corpus on later medical thought is undeniable. Galen of Pergamon, the most influential physician of the Roman era, drew heavily on the Hippocratic texts in his own writings. Galen systematized and expanded upon Hippocratic ideas, creating a comprehensive medical system that dominated Western medicine for centuries. The humoral theory, which posited that health depended on the balance of four bodily fluids, namely blood, phlegm, yellow bile, and black bile, became a central tenet of Gaelic medicine and was rooted in certain notions found within the Hippocratic corpus. Although the humoral theory has since been discredited, it exerted a profound influence on medical practice for over 1500 years. During the Middle Ages, the Hippocratic corpus, along with Galen's works, was preserved and studied in the Islamic world. Arab scholars translated these texts into Arabic, adding their own commentaries and interpretations. Figures such as Avicenna ibn Sina, whose Canon of Medicine became a standard medical textbook, incorporated Hippocratic principles into their own medical systems. The rediscovery of the Hippocratic corpus in Europe during the Renaissance led to a renewed interest in classical medicine. Scholars such as Thomas Linacre translated the Hippocratic texts into Latin, making them accessible to a wider audience. The emphasis on observation and rational explanation found in the corpus helped to pave the way for the scientific revolution of the 17th century. The legacy of the Hippocratic corpus extends beyond its influence on medical theory and practice. The corpus also provides valuable insight into the social and cultural context of ancient Greece. The texts reveal the daily lives of physicians, their interactions with patients, and their beliefs about the nature of health and disease. They offer a glimpse into the world of ancient medicine, a world where doctors relied on their senses and their intellect to diagnose and treat illness, working with limited tools and an incomplete understanding of the human body. The epidemics texts offer anecdotal insight into the widespread diseases present at the time, allowing historical researchers to estimate mortality rates and common symptoms. The study of the Hippocratic corpus continues to be an active area of research. Scholars are engaged in ongoing efforts to determine the authorship and dating of the individual treatises, to analyze their language and style, and to assess their historical significance. The challenges of interpreting the corpus are considerable, given the fragmentary nature of the evidence and the lack of reliable biographical information about Hippocrates himself. Nonetheless, the Hippocratic corpus remains a vital source for understanding the history of medicine as development of rational. Despite its immense influence, the Hippocratic corpus is not without its limitations. The understanding of human anatomy and physiology was rudimentary, and many of the treatments described in the corpus were ineffective or even harmful. The humoral theory, for example, led to practices such as bloodletting, which often weakened patients and exacerbated their condition. The absence of germ theory meant that the concept of hygiene in hospitals never developed. Furthermore, the authors of the corpus were limited by their reliance on observation and lacked the benefit of modern scientific tools and techniques. For example, the Hippocratic physicians relied on rudimentary methods of diagnosis, such as palpation and auscultation, which could be unreliable. The complex authorship, varied contents, and enduring legacy of the Hippocratic corpus invite ongoing scrutiny. The notion of a singular Hippocratic medicine is demonstrably inaccurate. This is due to the multiple perspectives and varying levels of expertise contained within the collection. The corpus acts more as a historical record of evolving medical thought, rather than a definitive statement of medical doctrine. In conclusion, the Hippocratic corpus represents a pivotal moment in the history of medicine. It marks a transition from supernatural to rational explanations of disease, emphasizing the importance of observation, prognosis, and ethical conduct. While the corpus contains inaccuracies and limitations, its influence on medical theory and practice is undeniable. The principles articulated in the Hippocratic Oath continue to resonate with physicians today, reminding them of their duty to act in the best interests of their patients and to uphold the highest ethical standards. The ongoing study of the Hippocratic corpus offers valuable insights into the history of medicine, the development of rational thought, and the enduring challenges of healing. Its enduring importance lies not just in its historical significance, but also, perhaps counterintuitively, in its acknowledgement of the limits of medical knowledge, a valuable lesson for every generation of practitioners. This serves as a reminder that medicine is ultimately a human endeavour, one that requires both skill and humility.